All right, so here we are, day 3 of ViVE 2024. And
for the On the Road edition of the Reverse Mullet Healthcare Podcast, I'm Ellen Brown and
I'm Dave Pavlik. And today we are joined by Dr. Arti Masturzo.
Perfect pronunciation.
I'm impressed.
You did great.
Everybody listening, we had to practice.
I had to practice several times.
Like many times, more than several.
Yes, but it made it really fun.
And by special request, I am wearing the mullet.
You're
just
rocking the mullet.
Thank
Looks
you.
really good.
Appreciate that.
So but we do have it on video, so people can watch as well. So without further ado, why are you here at ViVE? And tell us a little bit about yourself.
Well, I am viving because I'm obsessed with all things healthcare. And part of the solution that we've developed at the company that I'm at, CCS, incorporates a lot of digital health technologies and AI. And so it just made sense to come here and be here and learn and see what everybody else is doing.
Are you up in the vendor hall as well, or are you just a guest in the...
I'm just a guest.
No, this is like... I'm very skeptical about FOMO. And I have to say, like, people should legit have FOMO not being here. Like,
it's so much fun.
It is a really fun. They put on a really good show.
Yeah.
And people won't believe this because the pictures I'm posting make it look like I'm like this big, have a big fun time and put on the mullet. And I'm so not like that. And they really put on a good show. So
but it's Billy Idol tonight.
I know.
I mean, how do you beat that?
I know. You can't beat that. I know. People told us they were actually going to wear like mullet wigs because of Billy Idol. So, anyways,
we already have ours. Can you tell us a little bit about your upcoming study? Is that okay?
Yeah. So do you want to ask me about myself?
Yes.
So maybe I'll just start there.
Yes.
So I'm the Chief Medical Officer of CCS. I've been here for about a year and a half.
Okay.
And I'm a board certified internist by background and spent most of my time on the healthcare industry side. So I've been in healthcare services. I've run my own business in healthcare services. I've been in med device. I spent time at a large payer where I led value-based care transformation in the home.
We know nothing about that.
Oh my gosh. We're all about
value-based care.
Payment transformation.
Our life where we aren't just funding a podcast because we're passionate about it. We do a lot of work in value-based care. So we know that space very well. Keep going.
Yeah. Yes. So I led value-based care transformation in the home.
Okay.
So not just home health, but also just high acuity care in the home, like skilled nursing level care in the home.
Nice.
And I joined CCS about a year and a half ago. And what drew me to CCS is that this is a company that had been around almost 30 years. Will be 30 years, I think, in March or April this year. And it's the chassis is built on a distribution model for medical supplies. But what we learned in all these 30 years is that we have skyrocketing engagement. So you'll appreciate this from a value-based care standpoint, but we have over 85% engagement with our patients. And our patients stay with us for over 4 years.
That's incredible.
Wow.
So if I put my VBC payer hat on, I'm just doing this.
Absolutely.
Right? I'm holy
Yeah.
How do I make every interaction count?
Yeah.
And one of the things that I wanted to talk about at ViVE, it validated a lot of our thinking of what these patients with diabetes and chronic care conditions need. So we know that we have high engagement. We know that we have a lot of touches with these patients. The next question is, okay, are the solutions that we're building, are they actually going to make an impact? And are people going to welcome that? Because we can build whatever solution we want, but if the patients don't want that and they don't want to engage it, we're going to be twiddling our thumbs going, where is everybody?
Yep.
And so what we did is we hired a third-party survey company, Pure Spectrum, and we got over 1,500 responses. And the population that we surveyed are individuals living with diabetes who also use a continuous glucose monitor or insulin pump.
Yep. My mom.
Yep. So these are not healthy folks living with diabetes, because if you think about the medical necessity criteria for a continuous glucose monitor, these are not worried well, a touch of, as my patients like to say, I don't have diabetes, I just have sugar. Or a touch of sugar. Yeah. These are not a touch of sugar. These are complex folks, right?
I love that term, worried well.
Worried well. Yeah. But 72% of the responders have multiple comorbidities in addition to diabetes. And so what we learned through this survey is Number one, almost 40% of them said that they don't and didn't get the necessary information, education, support that they needed to actually manage their condition.
Absolutely. Yep.
So you've got a mom and you can.
I'm so excited we're going to have you on for a full episode. See, you haven't even said that. I think you said that today, but like I'm telling you now, you have to come on for a full episode.
You're never getting rid of me.
How are you keeping a straight face with this going on?
I know.
I'm pointing at my mullet, by the way.
I know.
I hide my freak flag very well, I think. That's what it is.
But we bring it out, don't we?
Yeah.
We do.
For sure. But so 40%, almost 40% said they weren't getting, they would get the device and they would get pamphlets. And I can attest to this, frankly, being a patient last year. Yeah. I'm sorry, handing somebody a booklet. Is not work. Education to support. Because you're overwhelmed at the time of diagnosis, and this is just hard. Especially this population, you're managing how many doctors and subspecialists? It's a lot to handle. And what was also interesting is that over 40% reported having a life-threatening emergency that took them to the ER. And of those responders, 82% said that the ER visit was preventable if they just had somebody that could have helped them.
Yeah.
So that tells us that there's a problem that we need to solve. What was really brought me hope, frankly, and just got me really excited is, remember, the reason I joined is like, let's capitalize on that 85% engagement and all those touch points.
Yes.
And what we learned is that over 70% of the responders said that anybody touching them in the ecosystem during their health journey, they would love for them to be more engaged in their health.
That's awesome.
Have it be less transactional. And the best part about it is over 90% said that they would trust their supplier. So companies like us.
Wow.
That over 90%.
Wow.
That they would trust their supplier to actually be a critical member of their care team.
Yeah, well, we were just asked. Somebody just asked us. And then we unfortunately have like 2 minutes left. I'm really sad. So we definitely have to do another episode. But like a full episode, because I want to hear all about this, is we actually had somebody ask us before about healthcare and like, are people more skeptical now about healthcare, and especially after COVID? And so it's really reassuring to hear you validate that, like, nope, people still want the system to work. They still want caregivers, right? And it's been validated. That's super exciting.
Yeah,
so.
They do. And they want to do it with people that they trust, right? Their doctors and then folks that they regularly engage with.
Yeah. All right. We have to go. I'm really sad.
We do.
So
thank you so much for stopping by.
I can take this as a yes. You'll come back and do a full episode.
This is a hell yes.
Okay.
That's a hell yes.
All
right.
Love it. I
you
love
have
it.
me at hello.
Okay. All right.
We're
cool.
in.
Thanks for
and
taking
you don't have
time.
to wear the wig every time.
Thank you.
Okay.
I'm going to take it off right now. Thanks for stopping by.
Okay.
Appreciate
Have a good
it.
rest of the
Thank
time.
you.
Bye.
Thank you. You guys are the best.